Welcome to the Feldenkrais Summit, Move Better, Feel Better. And we're on our track dealing with different kinds of physical challenges. And I'm very excited to be able to introduce you today to, I consider Mercedes von Deck a Renaissance woman. Not only is she an orthopedic surgeon who graduated from Harvard Medical School, but she has degrees in art history, and French. She's a ballroom dancer. She runs an Ashtanga yoga school. Mercedes has kind of lived the dream in so many ways, and yet has taken all of these different influences in her life and chosen to kind of channel it towards exploring the Feldenkrais method and how it can help people with injuries, and of course applying it to all the different things that she does, Feldenkrais with dance, Feldenkrais with yoga. And today we're going to be talking about back pain and how we can use the Feldenkrais method to help ourselves, as well as learn a lot about some of the causes of back pain and ways that we can address it in very practical and very empowering ways. Mercedes likes us to call her Didi. So when you hear me talking to her, think of your friend Didi as we get to know her. Didi, welcome.
Thank you so much. I'm so glad to be here.
So it's been quite a journey, your life, all the different things that you went through in order to come to finally training to be a Feldenkrais practitioner. And then, kind of turning that into a focus on back pain. Can you tell us a little bit about how that unfolded for you? Did you have pain, or was it the way you were working with people?
So I first learned about the Feldenkrais method in college when I was taking modern dance. And I didn't have any pain at that time, but I definitely had a lot of stress and tension. And I think my shoulders were up around my ears all the time. And so I found it was very helpful for me then. And I had a lot of shoulder strain. So actually I had shoulder strain as opposed to back pain. And then later on, when I started competing in ballroom dancing, I started doing Feldenkrais very actively. And again, it helped ground me. When I started medical school, I again developed the shoulder pain, which I'm sure is related to stress. And so I actually did Feldenkrais awareness movement every morning for like third and fourth year of medical school in order to help me get through the day. And then I finished medical school. I went into orthopedic surgery, and I saw that a lot of my patients really weren't being helped that much by what I was offering them. I mean, usually we would send everyone to physical therapy. Now, at that time, we were very fortunate to have a Feldenkrais practitioner who is a physical therapist who is a Feldenkrais practitioner. So I sent a lot of patients to her, but then she left, and then there was really no one. And I would try to show patients things from awareness through movement, and they would do it in the office, and they would have, they would feel better, but then they wouldn't understand, and they would go out and they didn't have any follow-up. And so they'd come back and they'd show me how they were doing the exercises with a lot of force and a lot of vigor. So they clearly didn't get the point. And I really didn't have the time in orthopedics to 15-minute office visit to spend with them. And so I began to refer them to people in the Boston area who were Feldenkrais practitioners. And some people went, but most people didn't. And so I've always felt this frustration of not being able to really help people through the Feldenkrais method. And so finally, a Boston training came. And so I am doing the training, and I'm really excited about being able to offer even more options for patients to do Feldenkrais through the hospital eventually, is my hope.
So it's really interesting, the constraints that are imposed upon them, sort of the doctor-patient relationship, this idea of the 15-minute visit, not allowing a person the time to actually find ways to heal themselves. It's almost as if it lends itself to the idea of trying to find a quick fix or a quick intervention in order to heal. So do you feel that once you get involved doing this teaching at the hospital, that they'll give you the time?
Well, we were able to start a yoga program at my hospital. Now, of course, yoga is very popular, but this started about 10 years ago as part of my yoga teacher training. We started a yoga program, because the hospital that I work at actually has a lot of low income patients, a lot of immigrants. And so it was something that these people weren't really going to yoga studios. And so it was very successful, and it's continued. And so I think that we could do the same with the Feldenkrais. Definitely the 15-minute visit has made it popular to just want to give patients a medication, refer them to physical therapy, get them out the door. We have referred patients to yoga because we have it. We can actually give them a referral slip. And so I think this would work as well for the Feldenkrais, and it would actually probably be more accessible to a lot of the patients that have more physical challenges,
Right.
be able to do Feldenkrais.
Right. Well, that sounds like a very exciting development, and I'm sure that there's a lot of people in not only in the Feldenkrais community, but in other disciplines thinking about, well, geez, how could we integrate something like that in our institutions? So we'll be looking at you as a model for that in the future. So I know that you have a little bit of a presentation that you would like to share with us about back pain, and it's the story of back pain. Does this feel like a good moment for you to do something like that?
Yeah.
Great. So I know that you have to share your screen, put on your glasses, get the slides. Just take a moment to do that.
So if I press this, okay. Oh. Okay.
You're on.
Okay. So I think that there is a lot of confusion about back pain and what people should do when they have back pain. And so that is largely what my presentation is about. It's about how life doesn't have to be a pain in the back, that there are solutions. And, okay, back pain is extremely common. There are a lot of statistics. I see this statistic all the time, that 80% of people will have back pain at some point in their lives. But I think it's actually even more common than that. And I have seen other statistics going up to 90%. And everyone has back pain. I've had back pain. My 3 kids have had back pain. My husband's had back pain. We've all had back pain. And again, I've seen different statistics for this, but it's often the second most frequent reason for visits to a physician. Some people say it's the most frequent reason. And it's one of the most common reason that people under the age of 45 find that they have to limit their activity. So why is back pain so common? I think a lot of it is because we do live in a very sedentary environment now. When I was a resident, which was back in the 1990s, we learned that kids did not have back pain unless it was something really, really serious. So something like an infection or cancer, or perhaps a fracture if they'd had an injury. And now I'm finding that kids really have back pain all the time. I mean, as I said, all 3 of my kids have had back pain. I see back pain in kids in the office quite frequently because the pediatricians also learn that back pain in children is serious. But usually they have back pain because they're sitting, they're doing their homework lying in bed, they kind of do this on their computers. It's funny because my daughters did this and I couldn't figure out why they were doing this. And then I asked the kids that I see in the office and they're like, yeah, we lie on our bed, we do our homework, crunch like this. We have the heavy backpacks, which of course we know are a problem. And everyone is becoming way too sedentary. Most jobs are sedentary now. Truck drivers have a very high incidence of back pain. And sitting puts 40% more pressure on your back than standing. So I have seen a trend going toward the standing desk. And a lot of my patients do say that that's available to them. And that's actually much healthier for the back. And back pain is not just important in terms of causing problems with the back. People who have back pain have more anger, more depression. They tend to be much less active. They don't have as much fun. They don't go out. They earn less. And once you have back pain, usually you will recover, but recurrence is extremely common. Statistics say that 16 million of all adults in the US, which is 8%, will go on to have chronic back pain, which is back pain that lasts longer than 3 months. And back pain is the leading cause of disability in the world. it costs the US more than $100 billion each year in medical bills, disability, and lost productivity at work. And I've had a number of patients, I've been in practice about 25 years now, and I've had patients that came to me from other physicians when I first started out in practice, and they were in their 20s and their 30s, and they were already on disability. And they would come because they had paperwork that I was supposed to fill out. They give me their old paperwork. I fill it out in a 15-minute visit. Didn't have a lot of time to explore why they were disabled at such a young age. And they have continued to be on disability my whole career, their whole lives, and they believe that they are disabled. And at some point, sometimes I will get another MRI, look at what's going on with their back or their neck, and really their findings are minimal. I'm not sure how they got on disability in the first place, but their whole lives, they have not been able to work. They're barely subsiding, whatever's worth, barely existing. I have one patient, it's kind of a funny story. He has back pain. He actually, narcotics are another big issue. He drives to the other side of the state to get narcotics from a physician that will give them to him. And he was talking to me about his wife, and his wife wanted to get surgery, but there's some place in New York that said that they could help her, but her insurance wouldn't pay for the surgery, and she would have to pay for it out of pocket. So I said, well, let me see her MRI, what's going on? And she came in, and her MRI showed nothing. It was perfect. So there's clearly no surgery that would help her. She was taking something like 8 Percocets a day for her life. And it was just so sad. And it's so hard to show people that this doesn't have to be the way they live. So what are some reasons for back pain? In up to about 85 to 90% of acute low back pain, no cause is ever identified. But the good news is usually that pain will go away. And there are a lot of pain generators in the spine. So, in the back, there's the skin, and you think, well, what would skin be painful? Well, some people come and they have herpes zoster, which is, a very painful reinfection of the chickenpox virus along a dermatome, and that can be very painful. There are a lot of muscles, outside the back, along the back, the bones, of course, the joints, the ligaments, the discs. Here we see the discs. I'll just show this here just because it's interesting. So normally, our MRIs don't look like this, but this was colorful. The fluid here, it's pretty. The fluid here is bright. It's this bright turquoise. And normally, normal discs will have a fair amount of fluid, which is based on their proteoglycan, which is the substance that makes them up, what the composition is, and they'll have a lot of fluid. As we age, our discs get more degenerative. So here, there's less fluid. You don't see that lovely blue. And the disc is actually herniated out. So that's a common reason for pain. The nerves, you can see the spinal cord usually ends around L2, L3, L1, L2, somewhere up here. And then the nerve roots continue on. So that's obviously a source of pain. Blood vessels. Again, back pain could be due to a problem with your aorta, ruptured aortic aneurysm. That's not very common, but it does happen. So there are other things to think about, again, talking about pain generators. There's just so many structures in the back that usually we don't, or many times we don't know what is causing the pain. So all the vertebrae, lots of muscles, et cetera, et cetera. So some of the things that can happen, muscle strain or sprain, that's usually an injury. Herniated disc, we're going to talk about some of these: annular tear, compression fractures, arthritis, spinal stenosis. A lot of people come to me with low back pain, and they have pain in their SI joints in the back. Probably can't see that. So sometimes they have bursitis in their upper back. And then there's some more serious reasons for pain. And this is what I find a lot of patients worry about. They worry that they have cancer because they know someone who had bone cancer in their spine. And sometimes they just want to know that they don't have cancer. This is very, very common. Infection is a reason. Spondylolysis, spondylolisthesis is the slipping of the vertebrae, and then other things. So kidney disease, bowel disease, pelvic disease, vascular disease, these can all cause some back pain. So usually with a back sprain or a strain, there has been an injury. People will feel tenderness directly over where they feel the pain. Anti-inflammatory medicines, non-steroidal anti-inflammatory medicines like ibuprofen are usually helpful. The pain is only in the back. And most will get better within a couple to a few weeks. Now, some people don't have a very big injury, and they will feel severe pain. And this can be a tear of the disc, and often it's just a little twisting injury. They leaned over to pick up a pencil. It can be extremely painful, but it will heal on its own. So here again, I have another MRI. You can see how there's fluid here. The fluid is bright, fluid here in the disc. And then here, this disc has lost some of its fluid. The annulus is this ring around the outside of the disc, and it's innervated. So if you get a little tear in the annulus as it dries out, it will be very painful. And sometimes the disc herniation, well, the tear will be large enough so the nucleus pulposus, the center, will herniate out, which we see here. So people often come in saying they have sciatica. They may or may not have sciatica. So sciatica is usually caused when a disc herniation presses on a nerve root in the spine. And usually the pain will radiate down the whole leg to the foot. The sciatic nerve goes down to the foot. They may not have any back pain. They may just have the pain. Usually it's a burning pain. Sometimes they have numbness and tingling going down into the foot. Occasionally, other reasons for sciatica could be a spondylolisthesis. So I mentioned that word. It's fun to say. The vertebrae should be lined up. So in this case, yes, spondylolisthesis. The vertebrae here are lined up, and then this vertebrae is slipped forward. It's L5, so it's slipped in front of, a little bit in front of L4 and actually in front of L5. Now, I know a lot of patients who, who have spondylolisthesis and they do fine, they don't even know. Sometimes it's just an incidental finding. And usually sciatica due to disc herniations will get better within 4 weeks. Not always. So here again, we're seeing the disc herniation. So here's the disc herniates out, the ruptures out the, it can rupture in any direction, but when it ruptures out the back, it will press on a nerve root sometimes. And it's that nerve root inflammation that causes the pain. So often people with sciatica, they may not even remember an injury. As I said, the pain radiates generally below the knee, numbness or tingling, sometimes weakness. Anti-inflammatories that are non-steroidal like Motrin can be helpful. And then there's degenerative disc disease, and a lot of people get this diagnosis, partly because as we get older, our discs degenerate. But this doesn't mean that they'll cause pain. So often what happens is people will have some chronic back pain, it continues, and then an MRI is eventually obtained, and you see that the discs are not, they don't have as much fluid, they're a little flatter. And so we give them this diagnosis of degenerative disc disease. Now, it may not even be the reason they're having pain, but as we said in the 15-minute visit, we give them a diagnosis, people feel happy, we go on with their lives, even if they don't know how to get rid of the pain. So in degenerative disc disease, usually there's a sort of continuous back pain. Sometimes it goes down into the buttocks, down into the upper thigh, or into the groin area. They can have flare-ups, feeling that the back is going to give out, often pain with sitting, twisting, bending. You can feel better with movement. And the thought is that with time, actually, but years of time, the degenerative disc spine will become more stable as the discs get even flatter, and there'll be less pain with time. Now, another reason that you might have back pain is in the joints. So in the back of the spine here, I do have a spine, but I guess it's hard to go back and forth. There are facet joints between each vertebrae. So the vertebrae, they're connected by the discs, which would be in here. And then in the back, each vertebrae is attached to the one above and below it by the facet joints. And like any joints, you can become arthritic, and the cartilage can wear out, and that can cause pain. The joints themselves, like our joints in our fingers, they can swell, they can get larger as we age. And so a lot of people can have some back pain from facet arthritis or facet arthropathy. Almost done with the reasons. So spinal stenosis. In spinal stenosis, it's sort of the same thing. When the disc, I have a spine, but I don't think I can show you. So
sure, you can show us. Go ahead if you want to. I mean, unless it's not on that spine.
Well, I mean, it's a little hard to see. If we go back, let me just go back really quick to here. So in addition, as we get older, the discs will bulge out the back, as it's sort of doing here. There are also ligaments. There's a ligament here. It's a fine black line. Oops. So there's a longitudinal ligament, which is a ligament here. The facet joints are here. So here's one vertebrae attaching to the facet of another vertebrae. And they hypertrophy, they get larger, the joint capsule expands. And then the nerves here don't have enough space. So this whole space, this is the space in here. This is where the nerves run. And it's the same space here. It gets smaller and smaller. So that's what happens with spinal stenosis. And it's more common as we get older. Oops. In the lower back, there's a fair amount of space and the spinal cord is stopped. So usually there'll just be pressure on the nerve. Often what happens is that the space for the nerve, as the tissue swell, as you walk a certain amount, you'll start having pain, often in the calves. So, and it's very reproducible often. So if you walk for 2 blocks, you have to stop, bend forward, the pain will get better, and then you can go on. In the neck, it's a little more serious because there's not that much space. There's the spinal cord, takes up that whole little space there. And so you can get more serious problems with balance, coordination, incontinence, and numbness and weakness in the arm and hand, as well as in the leg and foot. And then, of course, compression fractures. As we get older, again, especially for women, we don't have as much bone density to start with. And then as we lose bone density, as we get older after menopause, we can develop these compression fractures with really no trauma whatsoever. Some people have no idea that they've had an injury. Sometimes they don't have pain, but sometimes they can be quite painful. That's just one reason why we lose height. One reason is because the discs get flatter, but then another reason is the vertebrae compress, and the dowager's hump, where people are very hunched over, is from multiple compression fractures. And so treatment for those is generally, well, there is treatment for osteoporosis. So people who get back pain, well, everyone gets back pain, but if you've had a previous episode of back pain, you're more likely to have another episode, which of course is everyone. Sometimes it's high physical demands of work, but sometimes it is just a sitting job. Often people who are less happy with their job will have more back pain. As we get older, we have more back pain. As we get weaker, we have more pain. And then smoking is a huge risk for back pain. People who smoke have 2.7 times the risk of back pain, partly because the nicotine will constrict the blood vessels that nourish the vertebrae, the end plates. The discs themselves don't really have a blood supply. So the question of, do I need an MRI? One of my pet peeves is the patient that comes in and says that their sister told them, their physical therapist told them, someone told them that they needed an MRI. Now, most people do not need an MRI, but everyone wants an MRI. When I was a resident, MRIs were newer, I guess. And actually in the beginning of the 80s was when they really became popular. But so they were fairly common, but now they're even more common. And there was a study, a recent study, that showed that disc degeneration is present in pretty much everyone after the age of 60. But most of these people do not have any symptoms. And even in patients who are 30 to 39 years of age, on their MRI, they'll have disc bulges, they'll have disc herniations, they'll have disc degeneration, and they have absolutely no symptoms whatsoever. So getting an MRI and finding something on it really doesn't mean anything unless the patient has symptoms that go along with the findings on the MRI, and often they don't. So if you are considering surgery, yes, you need an MRI. There's an epidural steroid injection. We'll talk a little bit more about those. That's another good reason to get an MRI, because you need to know where you have a problem. But one of the problems, and I see this with so many people, is that they identify with the findings on the X-ray and MRI, and then they use those findings to define themselves. Even someone in Feldenkrais training was like, oh, yeah, it's my annular tear. You know, it just keeps acting up. And her annular tear probably doesn't keep acting up, but you know, she sees that. That's sort of minor. You know, my husband had back surgery before I even met him, and he's always very protective of his back. He used to play tennis. He used to apparently was very athletic. I've never known him to be athletic, partly because he sees himself as someone with a bad back, and it really limits what he does. And I see this with a lot of people. So there are some other reasons to get studies, and these are, we call these red flags. And there are reasons why you should get an MRI, might need surgery. So history of trauma, fevers and night sweats, which could indicate an infection. Incontinence could be a very bad disc herniation, unexplained weight loss, again, infection, or cancer, IV drug use, infection. So some of these things, having a history of cancer, the saddle anesthesia is numbness in the inner thighs, long-term steroid use, back pain at night, or severe and rapidly and progressive neurologic deficit. This could be an epidural abscess or something like that. So these are reasons, but most people don't present with these. So when you have back pain, what should you do? So usually people will take Motrin, ibuprofen, if they don't have any reasons not to take it. And these work for most everything. It will help. Most of the patients I see are the ones that have tried this and it doesn't help. So then the next line of defense often is, especially if they have like nerve root in pain, such as pain going down the leg, would be a steroidal medication such as prednisone, usually given in a taper. Often what is painful, the disc herniation may press on the nerve root. If you can just cut down the inflammation around the nerve, then the pain will go away and you don't need to do anything. Over time, the body will resorb some of that disc and people can be fine. So the prednisone is a stronger anti-inflammatory than the non-steroidal anti-inflammatory. And so we can give a short dose of those. Opioid medications, now of course it's a national crisis, so we really try to limit oxycodone, Percocet, Vicodin. It can be helpful in the short term, but usually only for a couple of days. And after that, it's probably not so helpful. Cortisone injection. So the epidural steroid injection, again, this is for a disc herniation. If you have nerve root pain, pain going down your leg, it's not helpful for back pain so much, but that can be helpful. They haven't been shown to make a difference at 6 months, whether you've had one or not. But in the short term, it can sometimes be very helpful. If you're really limited, you can't do the things you need to do, often people will feel dramatic relief of pain. Physical therapy is sort of the mainstay of what we do, what we recommend. A lot of patients don't like physical therapy. A lot of them need it. I mean, they're deconditioned, they don't do much exercise. If they've had back pain before, they often get more deconditioned because they don't return to the same level of activity. So they can benefit from the therapy, they just don't want to go. Radiofrequency ablation, this is where they burn the nerve, either to the facet joint, sometimes to the disc. It can be helpful. These other things are usually for very chronic pain that just doesn't get better. The spinal cord stimulation, electrical devices implanted that will give electrical stimulation to the spine, the same with peripheral nerve stimulation, and then, of course, surgery. Now, most people do not need surgery, but I have people come to me all the time, and that's what they're concerned about, is that they need surgery. Some of the options here, we won't spend a lot of time, but kyphoplasty. So if you have a compression fracture and the vertebrae is squished, you can expand it and inject cement. Hasn't really been shown to make that much of a difference for pain, though anecdotally it seemed to be helpful for a lot of people, but studies haven't shown it's that helpful. But it does help the deformity that people get. Discectomy is to remove the part of the disc that could be pressing on the nerve, and this is really only for people who haven't gotten better trying everything else. Laminectomy, again, they used to do this for the disc excisions, but now they can do the disc excisions for a very small opening. Laminectomy is to remove part of the bone in the back. This is done for spinal stenosis, just to open the space for the nerves that are being compressed, take out the ligaments that's compressing some of the joint hypertrophy that's compressing on the nerves. Disc replacement, again, it seems like the disc can be a source of pain. Again, this isn't really that well known. If it's just the disc causing back pain, And if a disc replacement will help, but this seems promising. Fusion is, again, for disc problems. But then it puts pressure on other parts of the spine. So if you fuse one part, then the motion has to go more motion in other parts, and this can cause problem. And this for spinal stenosis as well, which we won't really, it opens up the space. And so then what else is there? So I don't know if these are considered alternative anymore. I actually was surprised because traditionally patients would come to me, they'd want to see a chiropractor and their insurance wouldn't cover it. And I was just looking it up for the purposes of this talk. And I find that a lot of insurance companies will pay for some chiropractic treatment. If people have been in a car accident, the car insurance will pay for chiropractor and acupuncture. Studies have not been overwhelmingly positive in that they help. So chiropractic treatment, there was one big study recently looking in the military where they weren't really looking at what people were doing, and it wasn't blinded in any way. But it did seem that people got a little bit better if they had regular medical treatment as well as a chiropractor. Most studies are not really high quality studies, and so it's a little bit unclear how much it helps. People who get chiropractic treatment seem to be happier than people who just go to physical therapy, maybe because they get a lot of visits, so they get, the chiropractor sees them many times. Same with the acupuncture. Again, studies have not been done that really show that it is helpful for back pain. That said, a lot of people find it helpful. They've done some studies with sham acupuncture where they put needles in places that aren't along the meridians, and people get better as well. So that's unclear. Other alternative things, these really haven't been studied that much. Yoga, there's been a lot of research actually looking at yoga and back pain. It seems to be as good as physical therapy, and some people find a greater psychological benefit from doing yoga. So their lives improve in addition to their back pain, more than if they were just to do physical therapy. There have been very few studies on the Feldenkrais method. In fact, only a couple looking at Feldenkrais method and back pain. Again, it hasn't been conclusive. It just shows that it's as good as other treatments that are there. And then the big thing is lifestyle modifications. So a lot of patients could benefit from weight loss. Exercise, which is of course what we do in physical therapy, stress reduction. So mindfulness-based stress reduction, there's a lot of studies looking at that, but any kind of stress reduction. A lot of people with chronic pain, they're sent to these mindfulness groups. At our hospital, we have some mindfulness groups. We do have a lot of the mindfulness-based stress reduction. And sometimes this can be helpful. And then the CBD oil and cream, this is very popular now as it became legal in Massachusetts. It's legal in, I don't know what other states, but no, not a lot of research on it. Some people have told me that it helps, and a lot of people told me it does nothing. So, but it's out there. So this is just going to the Feldenkrais method. A couple of studies. There's a person in Teresa Paolucci in Rome. She was the one that did the studies. She's done several studies on Feldenkrais. There really isn't a lot of research. So we have a lot of anecdotal reports. There was a New York Times article in 2017, the Washington Post article, and both were, the journalists had found a lot of relief from back pain. And then people are always telling you how much better they feel. And I've even experienced this, not being a long-term practitioner by any means, but just in terms of working with some patients as part of my training. I had a young woman who was in her 20s. She had been in a car accident. She had a lot of neck and upper back pain and shoulder pain. She had seen a chiropractor for years. For the 2 years since the car accident, she was getting physical therapy. Her chiropractor told her this was going to be her new normal, and this is where she was. And I had not yet been really giving functional integration as part of my, it was sort of like just before my third year. And so I offered to work with her because obviously I do it for free. And she did get better in just several sessions. She was better. is back to doing her yoga practice. And so these sorts of, lots of these stories. One of the things that I think, so, Feldenkrais, I don't know where I got these things, but I think I read it somewhere. But obviously posture improves. This is from the New York Times article, Becoming Aware of How One's Body Interacts with its Surroundings and Learning How to Behave in Less Stressful Ways. It becomes possible to relinquish habitual movement patterns that cause and contribute to chronic pain. So one thing I've definitely noticed is that patients with chronic pain need to change how they see themselves. And I like this quote from Dennis Leary. Our job as practitioners is to facilitate a learning environment in which the student can begin to perceive more options than they are able to on their own. I have so many stories of patients who, as we were saying, began to define themselves as, back pain patients. I have this one man, he was probably about 50 when I first saw him. He came from out of state. His brother referred him because his brother was my patient. And he had worked at one of these tire changing companies. He didn't like the job. He hurt his back on the job and he couldn't work. And so he had seen people in New Hampshire. He had gotten MRIs, he had gotten EMGs, he had gotten bone scans as well as x-rays. He had gotten many injections, nothing helped. His studies were all normal. He came to me, it seemed like he had a disc herniation. That's what his symptoms were. Repeated all the studies, they were all normal. Nothing helped. Injections again. He went to the pain clinic at the Mass General, nothing helped him. I was talking to him and I found out that he hated his job. He felt that his employer didn't value him as an employee, just saw him as a machine to change tires. He liked being a tow truck driver, which is what he did before he moved to New Hampshire, but then he couldn't find a job as a tow truck driver. And he was stuck. He was stuck in this position because he had a lawsuit against the company. He couldn't get better until that was solved. And he truly believed that he had this back pain. And it wasn't that he was faking it, he had it, even though we couldn't find a reason. So I see a lot of these sorts of patients that can't overcome their environment or their situation, I guess, and they're kind of stuck in this period of pain. And so this is where I think Feldenkrais can be very helpful. Now, this particular patient, he did settle with his company, and I did have him do Feldenkrais with someone in his state. And he actually, when I spoke to his brother, he is back working and he's sort of regained his life. But there's so many patients that aren't able to regain their lives. And so I think this is where I find that Feldenkrais could be very helpful. I know Deborah Bose talks a lot about chronic pain. I know you, Lavinia, have done work with chronic pain. But as Feldenkrais says here, in order to change our mode of action, we must change the image of ourselves that we carry within ourselves. And this is so true for all of these patients, all of my patients that have been on disability, their lives. I just feel like they need to have a new way of seeing themselves, and then they could move on with their lives. So I think this is basically where I stop. I have another, Feldenkrais talking about health, living our dreams. I think people have to be able to redefine themselves in new ways. And this is where Feldenkrais can be helpful. In addition to the physical, changing our bodies, but through changing our bodies, it does change our conceptions of ourselves.
Well, thank you for that. There were so many things that came up in my mind as I was listening to you. And one of the things, sort of working backwards, the whole concept of self-image and being attached, and you said this many, many times throughout your presentation, of kind of the attachment to the diagnosis. I'm sure other people have said this, but the first time I ever heard it was Moshe Feldenkrais saying that you are not your diagnosis, and that people identify themselves with that diagnosis. But also, as you put it with this man who had the lawsuit, this idea that there's a payoff, or there's a reason for wanting to stay in this position. in his case. And when I first graduated from my training, I was working in a psychologist office who dealt with trauma and accidents and workman's comp. And the investment that people had to remain on disability and on workman's comp for various reasons, including lawsuits, I actually quit my job because I could see that they were getting better. One time, this young woman was walking and she was like, "Oh my gosh, I feel so free. I feel so happy." And her mother said, "No, you're not. No, you're not. You're not better. Look at you." And I was like, "That's it. I'm done with this job," because they were dealing with a lawsuit from a car accident. And, so that's a whole other world that we could talk about. But this idea that you brought at the end, that when we change what's happening in our movement or in the body, we change everything. And that's where I think the Feldenkrais method is really different from a lot of approaches that just look at the symptom or the injury.
Yes, exactly. And this is where I think patients would really benefit in all aspects of their lives. It doesn't have to even be with back pain, but anything or chronic pain. Um, everything can be made better. It's just getting people to understand that. I think that's what I find difficult now. And as an orthopedic surgeon, I perhaps can persuade some people, which
Mhm.
I was able to do that when I was trying to teach people, recommend yoga for people. They're like, well, if I teach, I recommend it, then they will do it. Um, but I don't think it should just be something that is available to people so that it's something easy for them to do. I actually teach Feldenkrais at the yoga studio, and it's very popular there because these are people that are already interested in improving how they're functioning. And so I have a very large audience there.
Mhm.
What I would like to do is be able to get more of the patients to be able to participate because these people need it perhaps even more.
Right. Well, it's baby steps, right? Because
Right.
we're asking people to shift almost like their paradigm view of the world and of what health is. And you spoke a lot in your bio about empowering people to take care of their own health and how important that is. So as a physician and as a Feldenkrais practitioner, how do you, and even giving, sort of, to those of us who are Feldenkrais practitioners, how do you see us as taking that step to empower people? You mentioned that there's very little research out there. I mean, is that something that we could pursue, for example, in some way?
Well, I think it's important in order to persuade not necessarily the patient, but the insurance companies, for example, to pay for this. So, back when I started in practice, the insurance companies were definitely not paying for chiropractic treatment or acupuncture. And there are lots of studies out there. They actually haven't shown a huge benefit, but now the insurance companies are paying for them. And people want them, which may be another reason, though people want a lot of things they don't get from the insurance companies. But I think research is definitely important because otherwise it's just another one of those things that, Reiki, so things that there's so many out there. Insurance company can't pay for everything. And a lot of people won't go unless they can get some help from, payment wise from the insurance company. And then also having it at the hospital. So now a lot of hospitals do have complementary or alternative or wellness centers. The Brigham has a big one, Osher, and then Dana-Farber, which is another big cancer thing, has the ZACOM, and they do include a lot of different modalities. A lot of it's not covered by the insurance, but the patients, it's available, so it's just there. And I do know someone who is doing some Feldenkrais at the one at the Brigham. He's a massage therapist, so he kind of throws it in. People don't know what they're getting. My husband doesn't even know. He loves it when I do functional integration on him, and he still doesn't quite understand it. He's like, "Oh, that's a good stretch," and I'm like, no. But anyway, he's doing it. It's making him feel better. So it's just a matter of just it being there, I guess, just being available to people. Like when we brought yoga to my hospital, Cambridge Health Alliance, we talked about, well, was it going to make that big a change? But it's sort of a change in the culture of just being there, being in the hospital, being at a place where patients go for their care anyway, And then they see it as something that they can do to help their care. It's not just for the flexible, skinny people who post on Instagram. So I think it's been very helpful having it in the hospital. A lot of patients who never dreamed of going to a yoga studio have tried it and found benefit. And so I think the same can be true for Feldenkrais. Just having it more places. And physical therapists doing Feldenkrais is great because they see these patients, so they can help them see Feldenkrais as something that will help them. Because otherwise, people, they're not going to just try it.
Well, you brought up this, you talked about all these statistics, $100 billion a year being spent, and, how people get frightened, right? Especially people who are older. You get a twinge in your back and you're like, oh, that's it. I've got spondylolisthesis, and I can't even pronounce it, but I'm going to go get surgery, right? Because it means it's the end of my life. It means that I'm going to have to be a cripple for the rest of my life. I'd better go get an MRI. The same thing that you said. I read an article where the doctor was saying the worst thing that you can do is look at your MRI.
Right. I'm not getting an MRI. I don't want to know because
right.
I'm afraid it will change my view of myself. I see myself as very functional, but I could have,
you could have all kinds of things, but that many people, this was a statistic that this doctor cited, that many people who see their MRI feel that their back pain gets worse after they've seen it, because suddenly they again have become their diagnosis.
Right.
And so, I think that, again, to educate the world about different options of what to do when I encounter back pain, instead of running to the doctor, running to get an MRI, what is the first thing that someone should do when they experience back pain? I mean, I know you have an opinion on that.
Well, I think most people should give themselves some time, but not totally stop everything they do. So back, I guess when I was in medical school, bed rest was still recommended, which is pretty sad. And that actually makes people worse. So it's better, you can definitely, if you need to take a day or two to kind of do less, that's fine, but don't stay out of work forever. Go back to your activities as much as you can. If you have a little bit of discomfort, that's fine, because that will actually help you. If you keep using your back muscles, keeping yourself limber is helpful. I think Feldenkrais is great. Whenever you have a problem, just get on the floor and do some. But for people who don't have that available or yet know about it, then taking some anti-inflammatories, ibuprofen is the perfect thing. And just giving yourself some time. Ice and heat can be very helpful. It's not the end of the world. I guess that's the thing. Some people, as you said, will just stop everything. And that can make things worse in the long run.
Right.
Feldenkrais is great. I mean, I have a whole bunch of tapes from the 80s when I was first doing Feldenkrais, and, just get on the floor and everything, there's loosen up the spine, you loosen up the rib cage, breathe better. The pain is much better, much more manageable.
Right. And you mentioned it, if there's a teacher available, but at this point, there are a lot of resources available to people. Even if you live in Podunk, you can go online. There are so many online resources for getting lessons, for getting little mini sequences that you can use to help yourself. And the beautiful thing for me about Feldenkrais is it's pretty hard to hurt yourself while you're doing Feldenkrais. And I think that that's one big difference between Feldenkrais and yoga. As wonderful, and I've been practicing yoga since I was 18, as wonderful and useful as yoga is, in the wrong hands, it can be a little bit damaging. Can you say something to that about the difference between those two?
Well, definitely Feldenkrais can be more gentle, and I think people in the yoga classes, part of the problem with these big yoga classes is that you can see the other people and what they're doing, and then you feel like you need to do that. And even if the teacher's telling you don't need to do that, other people are doing it. And so you do tend to go a little farther than perhaps you should, either in holding the pose or going a little, quote, deeper into the pose. And in Feldenkrais, really it's emphasized throughout that everything is small. You don't have to go as far, you should not go as far as you can go. It's more about experiencing that feeling. And I think in yoga, it could be that way, but I think it has become more of a visual, physical, you want to feel yourself working. And they do emphasize, a lot of teachers emphasize that physicality and working hard. And if you really, if you keep, going every day and working hard, then that's how you improve. And I think people do get injured that way. Well, Feldenkrais has a more awareness, I think, of the joints, the softening of the body, and increasing the flexibility through that softening, actually, I find is very helpful.
For part of it is our human tendency, right? I mean, as human animals, we just cannot help but compare, contrast, compete.
Yes.
And so in some ways, a Feldenkrais lesson that asks you to listen to yourself, not worry about judgment, not look at other people, kind of flies in the face of our human animal nature. It's asking for another level of intelligent application to the self. And and I think that that's hard for some people. I know when a lot of times when I teach, people will be like, well, could you show me how it's done? Show me how it's done. Just I want to do it right. And to tell people that you can't do it wrong with Feldenkrais unless you're hurting yourself, then it's wrong.
Yeah.
So to me, that's another aspect that we could turn to our advantage as opposed to a disadvantage. And I don't know if you've ever thought about it that way, that it's giving people permission instead of limiting what their possibilities are.
Yeah. I've said those things in my classes, and people will be like, wow, yeah, I'm not being graded. Wow. It's like
Exactly.
a revelation to them. And I think, we didn't really talk so much about the back pain, but, people definitely, after an injury, your back does stiffen up because it's protecting itself. So a lot of times we'll see that on the x-ray. If we get the x-ray, the back is much straighter than normal because there has been some sort of an injury. The muscles are in spasm. And then a lot of times those muscles stay that way. I mean, they're relaxed a little bit, but then they hold that. And then that, I think, is one reason why people have a greater recurrence of back pain, because the mechanics are just not effective. And so that's what's so great about the Feldenkrais is, again, you're finding all that movement, allowing the tension, the strain to let go, and then the back can do what it needs to do. I mean, most of the conditions that I talked about do not need surgery, and surgery has been shown 20 to 40% failure rate. People don't get better. There's a quote, failed back, what is it, back surgery? Yeah, that's a diagnosis, that you can code for, and because it's very, very common. And so most people, yeah, they just don't need surgery, I guess, except for, some of those red flag things where they have an infection or something like that.
Right. So having had a back injury and then trying to protect yourself from fear of pain can lead to more back injury. And so how can Feldenkrais help a person develop a deeper understanding or a better relationship with the mobility of the back, so that fear, that protection can kind of evaporate? Is that kind of what you're
Yeah,
saying?
I mean, people are always surprised. I'm sure you get this all the time, about how their back can just relax, so they can get flatter. They haven't been able to lie on their back, many for a long time. They
Right.
haven't had that ability. And just doing a lesson, at first they're wondering, well, how am I going to do this? I have to lie on my back. And then it comes and they can do it. And I was going to make a point, but I forgot.
That's okay. I think that you answered the question, but it did bring me to another question, and that is, of course, you said 80% of people experience back pain at one point or another. And so the question that comes up for me is, okay, well, is there, I mean, I'm already too late. I started this journey because of back pain, but what could people do to prevent back pain besides not sitting? Because we're trapped in a culture and a technology. I mean, you and I are sitting right now. So what are some things we could do to prevent back pain from ever happening, or at least to limit the possibility?
Well, definitely moving around frequently. So even if you're sitting, taking breaks, stretching, walking, which a lot of people don't feel that they can do, or they're at a job that doesn't allow them to do this. So again, you have to change things in the work environment. I wasn't going to mention, there's these people that make this chair. I don't know, I forget what it is, but it keeps moving. I don't know if you've seen this chair. So that
I've
when you're
seen a
sitting,
few different versions of them.
yeah, I mean, there's the ball chair. But then there's this chair, this guy in Vermont is making them. And again, you're constantly moving while you're sitting, which is a great way to be, or the standing desk can be useful. But I think it's important to do, to not, to keep physically fit, of course, keep your weight down, but do things that increase your mobility, or things that you like to do. No one's going to do things that they don't like to do. So I think it's very important for people to find some form of exercise or recreation that they enjoy, that they can do. I see people all the time as they get older, they just become less and less active, and they think that this is normal and they just accept it. And then it's too late. They almost can't go back and get, as the fitness that they need to be healthy. So again, I think Feldenkrais is a great thing to do to prevent back pain. But even if you don't do that, you just need to stay active. Don't just sit watching TV. Try to avoid all of the pulls of technology.
You brought up something that I don't want us to lose. And you mentioned it when you were talking about the guy working at the tire changing place, but the link between our emotional life and the quality of ease in the back. That when I'm not happy, you said people who are not happy in their jobs have more incidents of back pain, but do you feel that it's because of the emotion? Is it a chicken or egg kind of thing?
It's a little hard to know, but definitely I think anxiety and depression can go along with having more back pain, and it's hard to figure out what end to attack. I think you have to attack both, the physical and whatever else is going on. And that's again another reason why Feldenkrais is helpful, because I think it does help the anxiety and depression through the body by freeing things up. But definitely people who have lower job satisfaction, they aren't happy with their lives, they definitely have more back pain. So it somehow lodges into the back, or that's where they find it, or the shoulders, back and shoulders, neck.
Right. So it could be a combination of tension, um, uh, you know, tension in different parts that are affecting maybe even the structural integrity of what's going on in the back and the ribs. But it also, occurred to me, we talk about it all the time in Feldenkrais, that in a Feldenkrais lesson, we're not just moving, we're thinking, we're feeling, and we're sensing, so that through that process of movement, I'm moving not just the muscles, but everything is moving. And I was thinking as you were talking about whether, therefore, if people are unhappy and causing back pain, whether something like cognitive behavioral therapy has ever been shown to help back pain, or whether it's always a physical approach.
Well, I know that again, this is the problem with a lot of Western medicine. We can refer a patient to the psychiatry department, but it doesn't seem like it's an integrated approach. You know what I'm saying?
Mm-hmm.
So we'll say, well, yes, I think there's a lot of psychological overlay. You would benefit from talking to someone, and perhaps they do, but then they're not getting all of it together.
Mm-hmm.
If that makes sense. And there is a whole thought, of course, the body keeps score. So, a lot of things are lodged in our bodies that aren't going, are there and
Mhm.
causing pain, and you can't just make it go away. You have to do both work. I think both psychological and physical.
So an integrated approach, I like that word, right? And he's sort of looking at the situation from all angles, not just a physical or a mental, right? But looking at it from all angles and feeling, or you could say a holistic approach to back health, because your back is everything. I mean, isn't every nerve in the body in some way connected to
Well,
the spine?
yes.
So in some way, there's this information coming down the spine all the time. And to me, information also has to do with the brain and the emotions. Absolutely.
Yeah.
So great. Well, do you have anything that you want to add before I ask you my last couple of little questions?
No, go ahead.
Okay. Well, one of the things that we've been looking at throughout this summit is asking the people that we're interviewing if they have a favorite quote from Moshe, and I know, or from someone else. And you shared a couple, Dennis and Moshe Feldenkrais, and I didn't know whether either one of them, or maybe you had another one in mind that you wanted to share with everybody.
Well, I have a short one that I like a lot, but I'm afraid that I should look at it because I don't want to
Okay.
screw it up.
You are totally welcome to read it.
So, nothing is permanent about our behavior patterns except our belief that they are so.
Oh,
And it's what we're talking about.
mhm.
As I see this over and over again with almost every patient. Yeah.
Yeah. So belief, and it goes back to, when you were talking about the people who went and had fake acupuncture and
Right.
got better, right? It's
Right.
my
And they
my
get
belief that I can change or that I can't change. So,
right.
yeah, that's to me, that's a very, very powerful quote, because those people that say, well, I just can't do it, and it's like, well, no, it's not that you can't, it's that you believe you can't. Now, of course, it's funny. I was talking to a student earlier today, and we were talking about that, and he was talking about his wings, and I was like, don't tell me that you believe you can fly. You know, there are limits to our beliefs, but as humans, we have this incredible potential.
Oh, we definitely do.
Yeah. And well, and then the other thing that I wanted to share with everyone is that Didi is offering a bonus, and appropriately enough, it's an awareness through movement lesson called Free Your Spine. And you'll be able to click at the bottom of your video in order to qualify for it. No, in order to get it, you qualify automatically. So be sure to click on that if you would like to explore that for yourself. If you've never experienced a Feldenkrais lesson, if you do have back pain, even if you don't, awareness through movement
Great lesson.
lesson can be, just a wonderful, luxurious experience. So, Didi, do you have anything you want to say in closing?
No. Um, I know we had talked about me doing an FI, but FI, a function, ATM, but leading one, but definitely we've spent the whole time talking, which is great.
Oh, and if they want to have an awareness through movement lesson, they're going to get one by clicking on your link there.
Yeah.
So, well, thank you so much. It's been an absolute pleasure talking
You.
to you. It was very informative, and I'm sure that everyone has learned a lot. And thanks again. It was a delight to meet you.
Thank you.